Hey everyone, we're getting our weekly educational video out today. What I wanted to talk about was actually how to deal with, how to diagnose, and how to treat a disc injury. A lot of people have disc injuries that don't know what to do and they go through a lot of treatment. So I want to talk about my own experience with my own disc injury and then talk about how I approach disc injuries in my office to give the disc a chance to heal up or at least function better. So what I pulled up here was my own back, my own injury. I did a lot of dumb things back in the day, and one of them was playing football all the way through college. I got a lot of good life experiences from it, but it beat my body up really good. So what I pulled up here was an actual shot of my own MRI. Right here, these discs are relatively healthy. They're white, but down here they start to get black and they go out here. I have a significant herniation at my L5-S1, and it even presses on my nerve in my leg, and I used to get numbness and tingling down my leg. So I know what it's like to have a disc injury. I know what it feels like. It sucks. Some days when you get out of bed, it's so bad you can barely move. But I'm a testament to what my treatments have done by getting treated by the expert in this system. He's trained in the integrative diagnosis system and he created it all, and he's really helped me get back to functioning and being a normal human. So I want to go over how we approach that injury. So the whole premise of this video was how to treat a disc injury. So you saw on my MRI, I have a significant disc injury in there, but I'm doing really good. Over a year ago, my disc was so bad I was getting constant numbness and tingling down the leg, unrelenting back pain. I could barely move sometimes, and it took me about 2 hours in the morning to get up and move. If you're one of those people that has that type of problem, you know what it's like, and it really sucks. So over the last year, I've gotten some intensive treatment in the integrative diagnosis system, specifically with manual adhesion release. So what happens is when you have a disc injury, you have your two bones and they're stacked up in between there, and in the middle is the disc. The disc is a really good shock absorber. It can handle force like this all day. What happens over time with trauma, bad postures, too much sitting, over-exercise, all the muscles around there, they get overworked. They don't get enough blood and oxygen. When that happens, they develop this stuff that's called adhesion, also known as scar tissue. When you get the adhesion, what it does is makes the muscles weaker and less flexible, which is bad enough. But the job of these muscles is to support and cushion your spine and your disc, and they can't. So what happens over time is now that disc starts to slide and grind on itself. When that happens, you get tearing in there, you get herniations, you get bulges presenting on an MRI with a disc type of degeneration. So the only chance that disc has to heal up or at least get functioning better is to get the pressure off of that. That's where the adhesion comes in. So the adhesion is completely reversible with expert diagnosis and expert treatment. So doctors that are trained in the integrative diagnosis system, specifically manual adhesion release, are able to get in there on the muscles, very precise and very focused with their hands in an instrument. And over a series of visits, they're able to get rid of all the adhesion. As you do that, the muscles become healthier, they become stronger, and they become more flexible. And they also get the pressure off of the disc. I use this analogy. Pretend that your disc is your thumb and it's stuck in the car door. The car door is the adhesion. You can't give this disc or this thumb a chance to heal up until you remove the adhesion or the car door. That's what we do. That's how we approach injuries, diagnosis problems, and disc injuries in our clinic. Getting in there and improving the function in a more long-standing approach so you can have a better outcome and you can function better. If you're having a disc injury, you know someone that has a disc injury, please share this video with them. Send us a message, comment. We'll respond to every single person out there. We're out there to help, and we're trying to do the best to educate the world so that people don't have to suffer like I had over the years. Thanks for watching, and please share this with anybody.